I'm Joan McTigue, and I'm a physician assistant in the Division of Rheumatology at the University of Florida and the VA Medical Center in Gainesville, Florida. One of the biggest misconceptions about gout is that it's more of an intermittent nuisance than a serious, chronic, potentially progressive, and disabling condition. The pain of an acute attack of gout can be the most serious pain you'll ever experience. And if gout is neglected, it can lead to permanent joint damage. There's also some initial evidence that high levels of uric acid, or perhaps gout itself, may be associated with kidney problems and heart disease. So for many reasons, treating gout is very important. Treatment of the acute attack is always the first priority. Early use of an anti-inflammatory agent is usually effective. Management of these attacks must be understood as separate from any long-term urate lowering. The long-term goal of gout treatment in patients with recurrent attacks is to lower the serum uric acid level to less than 6 milligrams per deciliter. This is a level that can begin to actually dissolve the crystals. But at a level over 7 milligrams per deciliter, crystals can actually continue to form. In patients who have tophi, which are collections of urate crystals under the skin, or with kidney stones, we often try to get the uric acid levels even lower, to less than 5 milligrams per deciliter. We can do this through lifestyle changes and medications that lower the uric acid. It's not enough to just start the medication. The uric acid lowering medication needs to be prescribed and taken at a high enough dose to properly dissolve the crystals in your joints. If the uric acid lowering medication is working, the shifting and dissolving crystals can, unfortunately, temporarily cause gout flares. That's why we prescribe small doses of anti-inflammatory medication to take at the same time. Over time, the attacks or flares will subside as the crystals break up and your uric acid levels go down. Taken at the right dose, uric acid lowering medications are very effective, and the lifestyle changes we recommend include weight loss, eating well, and overall healthy living helps too. Today we have wonderful treatments for gout. But the key thing to understand is that you'll need to stick with treatment over the long term, even when you get to a point where you feel fine.